Welcome to episode number 2 of The Great Blue Shark. I'm your host, Chris Hopper. Today, joining me is Richie Sontag, principal consultant at ConnectDME and managing partner at the Connect Clinic. Richie, we go way back. I don't know if we go back as far as you and Mark, but we got a little history behind us. I don't even know if we want to go into the first day that we met, first conversation, but I'll let you be the judge. You be the judge of that. And it's only gotten better since that first introductory.
Absolutely, yeah, for sure. I know my computer's doing a lot better. The first time that we met, I tried to contact you. I got on your website and ended up having to buy a new computer, but we don't need to bring that up to anybody. I appreciate you having me on today, Chris.
Yeah. So, Richie, over in Tulsa with ConnectDME, like I said. Richie, how did you get into the healthcare space?
Right after college, I started in the pharmaceutical industry, sold pharmaceuticals for a while, and then got in the DME world, had a urological company selling catheters, and then just was in it for about 15 years and decided to go out on my own. I had a partner in the past that had a DME company, and we got together and talked about being transparent, not using insurance, trying to be fair with our pricing, wanting to be paid faster, wanting to provide a great service for a fair price. And that's why we started ConnectDME.
That's good. Was you ever over on the broker side, or were you always been on the fulfillment end of healthcare?
Yeah, I've always been a provider. I just always fought the insurance companies, to be honest with you. I never sold it. Being in medical, had a lot of experiences in cardiology, urology. Like I said, I sold pharmaceuticals for a while and knew the way things worked and wanted to stay as a provider.
From whenever you was working as the employee over there on the pharmaceutical side and taking the jump over to being an entrepreneur, tell me what was that like?
So it was a little scary at first, obviously, but knowing the products that I had, things that I had sold, and knowing that there was a need and wanting to provide it for a fair price, doing the right thing, it was scary at first, but then easy to do and easy to stick to, and we've had a lot of success.
So your relationship was with the doctors or the patients?
So initially it was with the doctors. I was selling to the doctors, selling them different products, selling that then changed into a fulfillment where we were selling like a prescription for catheters, where we would go and talk to doctors about referring patients to us. We would sell catheters to the patients that were referred by the physicians. Initially, we were in the insurance world where we were sending product to the patient's home, drop shipping a lot of products, then waiting on insurance, billing the insurances and waiting 90 to 120 days of waiting to get paid.
Gotcha. Insurance comes up a lot. In your opinion, is insurance easy to understand for the doctors? And then we're going to follow that up with, is insurance easy to understand and use for the individual side?
So I think people have been embedded in their head that they have to have insurance, that it's something that you can't live without. I think there's a big scare, catastrophically speaking, that you have to have insurance to be able to afford your medical care. I think in the beginning, insurance was very easy. I think doctors liked insurance. They made a lot of money. There were doctors that wanted to take as many different insurances as they could, and they profited off of it. I think as the insurance has evolved, physicians don't know much about the insurance. They don't know. They're thinking it's like the old way where the patient isn't going to come out of pocket, where all things are covered. But insurance, I feel, has become such a game that physicians don't understand it, and I truly believe that the end users, the members, don't understand it at all. They get confused with copays. They get confused with deductibles. They don't know why their deductible's so high. I think they know that they have insurance. They feel like they need insurance, but they're not using insurance. They're not using it. They're scared of medical debt. They're scared of getting into something that they quite don't understand, so they stay away from it.
And they're scared that whenever they go to use their insurance and they go to place that card in the vendor's hand and then they owe a bunch of money, then they're like, I don't even know. I thought insurance covered this. And then they find out that.
Absolutely. Absolutely. And then you see patients that aren't getting the care that they need because they don't want to get into medical debt. They don't want to get into the whole conversation because A, they're not sure what it is, and B, it's probably going to cost them too much money.
So you're telling me that members have insurance oftentimes, but then don't utilize the insurance because they don't understand it and they don't want it. They're afraid that they're going to get into something too deep. It's going to cost them more, and it's not going to pay for it.
I believe that to be true. Yes, I do.
Very interesting.
What's your take on that?
You know what? I think you're exactly right. We look at what's going on in the overall economy and in the news articles in the healthcare space. We keep seeing a statistic that continues to rise, being medical debt. And then we've got a certain part of the population is not insured, but the folks that are entered in taking on this great debt, they have insurance. And so you sit there and scratch your head is, okay, if the person has insurance, how are they going into medical debt? And I think it all leads back to, and you can correct me if I'm wrong, but we've got insurance plans and a lot of employers are offering them, which is great. But a lot of times those deductibles and those out-of-pockets continue to go up and up each and every year. So in essence, the member may be functionally uninsured because they've got to come out of pocket $7,000, $8,000, $9,000 before their insurance may cover a large portion of it. I think it leads back to it's hard to understand the insurance, and people are scared to use it, and sometimes they opt to not use the insurance and just forego that care. Do you see that very often?
Absolutely, yeah. So they're paying for a product that they truly can't afford to use, is what it boils down to. We see patients that go in, being in DME, we do a lot of products for patients after surgeries. We see patients going for a surgery and not understanding if it's not a bundled price, if it's not something that they know what they're getting into, they feel like they can't afford that next step. They'll go in for the surgery, then they can't afford the DME, or they can't afford the physical therapy, or they can't afford to go in and see the physician afterwards. If it's not bundled up and it's not clear to the patient, they truly, I think, just walk away from it.
Gotcha. Okay, so we'll talk about bundles a little bit more later on in the podcast here. From a technology side, how has technology advancements been a game changer or not a game changer for your business?
So technology is big for us. It's a great way to communicate with the different TPAs that we work with, different portals that we're able to get on to verify the patient has benefits. Internally, we created our own software where we can speak with patients, we can communicate with each other internally in the office. It's a way to communicate with each other and make sure that we're all on the same page.
Yeah. So technology is a crucial piece. So you've got to, when somebody calls in to verify benefits, you've got to be connected to not just one TPA, but you got to be connected to multiple TPAs. And you've got software that tells that. So members where do they get? Do they go to a pharmacy to connect with you guys, or is this telephonically?
Yeah, so we communicate through members. Everything starts with a prescription for us, and then we communicate with the members' coverage, right? So we'll contact the TPA, jump on their portal, see if the member truly has the benefit. We then verify that they are covered. We verify the pricing. We're very transparent in all of our pricing. TPAs know exactly what they're getting into, or self-insured companies know exactly what the price is before we send the product. We then we call the patient and verify the patient's address. We talk to the patient specifically about each product, what they're needing, the sizes, what their physician suggests. We don't change any product that the physician wants. If they want a certain name brand, we've been in the business for over 30 years and work with every manufacturer, so we feel confident that we can fulfill any prescription or any brand that the physician. We use technology to do a Zoom with the patient if they have any issues with fitting or if they have any issues with any of the product specifics. We're able to reach out to them over the web. We also communicate well with them through our software. We're able to text the patients if they have a reoccurring products, as in CPAP supplies, diabetic supplies. We're able to reach out to the patients however they would like to be contacted, through email, through text, and let them know that they're up for the product they need.
So it almost sounds like you're running a kind of a white glove concierge service when it comes to the patient and the patient care. And you guys take a vested interest and want to make sure that patient is taken care of. And that's something that is, we don't see a lot on the medical side of things. It's more about the company and the rules. And it sounds like that you go a step further.
Absolutely. We're very proud of our customer service. We get to know the patient, know the product that they're on, answer any questions, and we always make sure the patient has our contact where they can reach out and let us know if they're having any issues or if they need any assistance with any of the products.
So if I'm a member of a health plan and my doctor orders, or I guess that's where the prescription starts. If the doctor says, hey, you need to get physical therapy or you need to get the equipment that you guys have, the member has a choice to go to the pharmacy or whatever, wherever place they choose to go. But if they reach out to ConnectDME, then normally the cost for those services is zero, because you guys have a financial agreement with the TPAs and a lot of the employers out there, that if they utilize your services because it is transparent, it is economical, then they waive that out of pocket for the members. Is that correct?
That is correct. Yeah, we want to make sure that we provide value. We get a direct contract with a third-party administrator or with a self-insured company. We let them know exactly what our pricing is. If there's any products that are the patient needs that are not on our pricing, we contact the TPAs or the self-insured companies before and let them know this is what the charges are going to be. We use the threshold of Medicare, so we try to stay below Medicare allowable. A lot of our products are 95% or lower than Medicare allowable. The most popular products that we sell, we have about 150 products that we ship each day, and we pride ourselves on the lower cost. We can be as low as even 60% of Medicare allowable on some of the cost. And we do that just through buying right, just through the relationships we have with the manufacturers. And we're able to provide a good quality product and show a savings to the self-insured or the TPA, and normally zero out of pocket for the patient, because we are a lower cost. We're providing our goods for a lower cost, that they waive the deductibles and the copays, and patients can call us and receive whatever they need at no cost. It's truly a good way to take care of your patients and save money.
Do you see very many fully insured carriers utilizing your services, or is it mostly the companies and the TPAs that want to get a handle on what I would consider out of control medical costs?
Yeah, so we don't have any private contracts, so we're unable to even bill any of the BUCAs. So it's just self-insured companies and TPAs. We wouldn't be able to help Medicare, Medicaid, or any of the private insurances.
Okay. That's interesting. All right, so you've got a niche market that you're catering to, and you're going after the self-insured companies out there, associating yourself with TPAs. Why, if I'm a member of a plan, do the members always seek ConnectDME out, or do they go and do it their way and it costs them money out of pocket when they could have done it the other way? What do you see?
Patient education is the key for us. Obviously, the members that we work with, the companies that we have partnered with, we need to make sure that the members know that they need to grab that script and send it to us. Once a member sends us a prescription, we truly have them for life. They know that they can get a good quality product, they get it at no cost, and they get all of their prescriptions and send to us. There are members that don't utilize our company, but it's normally because they have no idea that we exist. That's why we work well with nurse navigators. We work well with HR professionals to let them to communicate exactly how the program works and what the patient needs to do.
So what's a nurse navigator? What do they do?
So nurse navigators are someone that they're the liaison between the provider and their employer or their plan. And what they do is truly, I always like to say that they rock the baby. So what that means is a patient will call, and let's say that they would need a a total hip, total knee, total shoulder, any kind of surgery, they would call one number. It would go to a nurse navigator. The nurse navigator would talk to them about the surgery that they need, talk to them about their physicians that they would like to use, show them options of either going in network with their current insurance or going out of network using a direct contract. She would let them know that if they do decide to go out of network and go using a direct contract, normally it would cost them zero out of pocket. She would set them up with the surgery. She would schedule that. She would also take care of any products that they would need afterwards, DME being one of them, physical therapy, any type of imaging. She sets them up and directs the patient. She truly takes care of the patient and lets them know these are their appointments, these are what's needed, and more of a concierge, more like you said earlier, a white glove service to make sure the patient's getting exactly what they need, keeping the patient compliant and making sure that they're taking all steps of the surgery.
So you mean to tell me if my doctor says, hey, or one of your members has to have this procedure done, whether it's a knee, a hip, a shoulder, an elbow, or have to go to an inpatient or an outpatient facility, if they've got a nurse navigator, they can call that person and have them set everything up to where they're not missing anything and there's no surprise bills?
Absolutely. They can call them before, during, or even after the surgery to make sure that they're doing exactly what they're needing, getting the services that they expect, and that they're being taken care of.
Wow, that's it. That is a concierge service. I didn't know there was anything like that out there. Is that similar to the DPCs, the direct primary cares? Do they have a similar type role?
Direct primary care, I think, is where it really all starts. Direct primary care are the first ones to see the patient, see that there's an issue, and understand what the patient needs. I think direct primary care is the new wave of medicine, taking medicine back to like it was in the 50s, where you had a physician, they understood what you needed, and they took care of you. They're able to direct the patient either to a nurse navigator, to a concierge service, or even refer them to the providers that are in their private network, or what I would say in their direct contract network.
Gotcha. So I think that's probably where the big misalignment has come, in my opinion, over the years. Is in the past, the doctors, they made house calls, and not that they need to make house calls today, but the doctor was a trusted advisor, a trusted relationship. And then once insurance started coming into the picture and you weren't just paying cash all the time, a lot of the hospitals started buying up doctors' practices. And once a doctor enters into those agreements, sometimes the chief that owns the doctor now has requirements for those providers, and they have to send and refer care and labs and images and stuff like that. And a situation such as yours, if you're working with the nurse navigator and the DPC, your whole goal is to make sure the member gets, number one, a great experience, a good price, and when they do that, they're rewarded. How are you? Go ahead.
Absolutely, yes. So if the primary care physician is in the network, they're handcuffed. They are being told where to send the patient, how to take care of the patient, what the patient needs next. With direct primary care, they truly are free to decide what it would be best for the patient and how they think the patient should be handled. Absolutely.
Let's talk about marketing. How are you marketing in 2023? What do you do to get the word out about ConnectDME?
So the people that we really go after are brokers, third-party administrators, and self-insured companies. So we market ourselves at different conferences. We talk to brokers, explain to brokers what we need, what we're about. And once we have a broker, they like to spread us out throughout all of their clients. It's a win for both. There is no PPM with our company. This is where it's going to pause.
There's no extra cost to do business there. You're just
There's no
providing
penalties. There's no penalties if you decide to use someone else. If there's a product out there that is going to be less expensive, or if they want to buy it locally, that's absolutely, they can do that. We want to make sure that we provide value to the patient, that the patient is happy with our products, and that we provide great customer service.
Yeah. So the biggest key in working in brokers or anybody that's working with a product such as yours and a solution such as ConnectDME, it's about educating the members. It sounds like to me, because most of the time, what we've seen from my side is when we're talking about open enrollment, nobody really cares about anything about their medical plan until they need it. It's when they need it is when they need to remember, hey, how do I get this? Probably education is going to be one thing. How can a business owner educate their members to remember the Connect DME?
So we provide all type of different marketing products. We have anything from magnets for kitchen refrigerators. We've done payroll stuffers. It has to do with how the employer communicates with their patient. That's, again, a nurse navigator is a great example of that. If the patient doesn't have to know all the tricks and the trades, if they can call a number and a nurse navigator know how to take care of them, that I think is key. But just making sure that the patient understands or can refer to someone to walk them through it.
It almost sounds like the employer has to take a vested interest in wanting to take care of their members too, and they're instrumental in designing the plan and wanting to educate their members on how to get the best care at the most affordable price. Is that right?
So we've worked with huge companies that save millions of dollars on healthcare, and they save that because they're very organized, they put money behind it, and they understand how it works. They use that through they save through direct contracts. They're able to waive many costs for the patient, so the patient will go to the places that they have contracts with and be able to save money that way. I think it's important that everybody has to be on board. The patient has to have a little skin in the game as well, but if utilized correctly, it's a win for everyone.
You've mentioned direct contracts a couple of times. What is a direct contract, and what makes that thing special? For obviously, if we got a direct contract, the special for us is we're saving money because our out of pocket. But what does a direct contract do for you?
So direct contract just confirms that both parties are on an agreement to the transaction. It brings it back more to business. There's no lottery billing. Everyone knows what's going to happen. So a direct contract to me is transparency. Through a direct contract, we have our price, description of product, and the HCPCS code. We know what we need to be paid, and they understand that is the price. And there's not going to be any hidden fees. There's not going to be any surcharges or discounts, nothing like that, because the price that we have is the best price that we can provide the product for, and it's truly would be a money maker, money savings.
So instead of having a big inflated price and we get an artificial discount off of that, you're just saying, hey, here's the price. This is what we need to get paid. It's fair for them, and you're paid expeditiously. They're paid, and it's a win for everyone.
It's business to business, bringing the buyer and the seller together. We allow the payer to control their medical costs.
Has your space changed a lot since COVID?
I think that our space has improved. We've grown year over year for over 8 years. And through COVID, people didn't want to go in and see the physicians. People didn't want to make the trip into the pharmacy or go to a DME house. So we're able to talk to the patient over the phone, get the specifics we need for each product, and then deliver it direct to their home. We ship all over the country. We can get the product to the patient within 24 to 48 hours of receiving the prescription.
So you're like a Kroger of durable medical. I love it. Kroger, Amazon. Last question, Richie. Where can people find out more about Richie Sontag, the man, the myth, the legend, and ConnectDME?
So ConnectDME we're obviously online. They can reach out to me anytime. We have our office number, our email address. I'd love to talk to anybody that's interested in saving money. DME is going to be a very small spend of their entire healthcare spend, but we're able to save thousands of dollars for each patient and hundreds of thousands of dollars for the employer.
And ConnectDME, you guys, like you say, you're running a white glove service, and long after that surgery, you're delivering products to that member that it's going to be a special relationship. And hey, Richie, thanks for joining me. Thanks for everybody tuning in. If you got any questions you'd answered by the Great Blue Shark, feel free to reach out to me on LinkedIn and the link in the description. And Richie, thanks again for your time, and I look forward to many more podcasts to come.